today we are going to demonstrate how action learning can be a very powerful tool to engage physicians as well as improve physician leadership effectiveness.
So my organization has worked with several different healthcare systems across the country doing on-site physician leadership programs. And one of those programs has been delivered at Atlantic Health System. It's an applied physician leadership academy, and by that we mean that we go into organizations and we identify what the organizational priorities are given that organization, their culture, and their physician leaders. We start out by doing an organizational priority assessment so that we can identify what the key challenges are in that organization. And we also do individual assessment and coaching for the physician leaders that are part of the program. That assessment analysis really helps to frame the customized solution that we come up with. But regardless of what the solution ultimately is, it pulls upon what we know to be the best in adult learning theory. Our programs focus on a 70-20-10 rule, and that 70-20-10 rule means that when you're trying to develop as an adult a new skill set, you ought to be spending 70% of the time actually on the job practicing the skills. It is about taking risks and sometimes failing and learning from those risks and developing new leadership effectiveness. The other 20% of the 100 is around individual assessment and coaching, either through external coaches that are executive or physician trained or internal mentors within an organization. And the coaching program focuses on a competency model that we've developed that talks about how physician leaders need to be effective in 4 leadership clusters. The first is around leading self, which is all around emotional intelligence. The second is around leading results. The third is around leading change, very much important today. And the fourth is around leading teams. And then the last piece of the program, which may surprise some of you, because most of your educational training as physicians is much about this, is the didactic training session. So we do just a small piece of that, because while it's important to understand the theory, and you can't necessarily glaze over that, you have to understand the theory, what's really important is practicing it, making it experiential. And so without further ado, I'm actually going to turn the mic over to Greg. He's going to talk in some detail about that experiential learning, which is what action learning is.
By way of introduction, I am a physician in Atlantic Health System, which is a multi-hospital system. The majority of our physicians are on our voluntary medical staffs, not employed. We do have a rapidly growing number of employed physicians, including at one of our institutions, department chairs, service line medical directors, of which I am one. And we have others who are in interim roles or interpositional roles, transitional roles, contracted, and so on. So it's a pretty diverse environment. And as part of our education for physicians, we've always had courses and seminars and various programs. But it was more on the theoretical, the didactic, and the pure educational, not necessarily hardwired to any implementation or action being placed. Very difficult to assess a return on investment for that, what really came as a result of this. You know, it's great for you physicians to have more knowledge, but what is it doing for the system? What's it doing for our community? What's it doing for our patients? What's it doing for our C-suite? So as part of that evolutionary process of our education and physician leadership and development training, we work collaboratively with Tracy and her organization to develop we call it the Atlantic Physician Leadership Academy, APLA, as everybody in our system calls it, and a big part of that is the action learning. As Regina did speak about yesterday, applied learning is such an important thing. And it's not something that we as physicians are typically exposed to or comfortable with, especially once we get into our professional roles for an extended period of time. We did a tremendous amount of work in preparation, which I think was a key to success, to get buy-in from our physician leaders and buy-in from our administration as to what are the challenges that we face, what are some very practical problems that we want to be able to address. Because without that focus and that buy-in and physician involvement in choosing the problems that we were going to address, I think it would be a little bit more difficult to get the involvement and buy-in. What came as a result of the applied physician leadership training? We had 4 problem statements that we chose to explore with each of the teams. So it was team-based interactive learning. How do physician leaders execute on their roles and responsibilities? In going through the action learning, we sort of reframed that after getting a lot of input from various stakeholders. Stakeholders including all of our senior executives, managers throughout the levels of the organization, voluntary medical staff, and people from finance, all throughout the organization. We came up with a revised problem statement, really that we as physician leaders wanted to be more effective in our roles and responsibilities. The specific recommendations were to have better ways of aligning our physician leaders by clarifying roles, by redefining job descriptions, and then by creating incentives to align with our senior executives and our overall health system goals. It sounds pretty straightforward and intuitive, but you'd be surprised how often those things are unclear or misunderstandings about, am I doing a good job? What is the job I'm supposed to be doing? How well am I doing it? And how do I know? And what impact does it have? So we've, in a very short period of time, created these job descriptions and alignment with skin in the game and teeth associated that has really started us moving forward to that level of increased effectiveness. We also recommended structural change. And this, speaks to some of the barriers that you have to deal with in these situations, including issues of threat within the organization, lack of trust, lack of certainty about the future, threat to change, both within the physicians and in the physician-hospital interface. Another important learning for this action process is matching the intent and the impact. So we found oftentimes, particularly as physicians, we may make assumptions on what we do, what we say, and we know what our intention is, but often the impact is very, very different. And if you're not actively engaged in a constant feedback and listening, you're going to, get into trouble. So modification based on the conversations, effective conversations based on effective listening was really a hallmark of the overall program. Some of the key results, not necessarily the direct outcomes, were an increase in the competencies of the physician leaders. And an important part as well was the assessment, as Tracy mentioned, of competencies at the beginning, emotional intelligence, 360 feedback, because oftentimes, as was also stated earlier in the program, we're very poor at self-analysis and very inaccurate in our self-assessment. So having assessment tools and then measurable results in behavioral change in particular was an important part of the program. Creating a new sense of we, creating the culture and changing the culture, not by expecting others to change, but by being self-reflective and knowing what we're doing so that we can then embody the behaviors and the conversations and the communication styles that we want our organization to move towards. Real-time application is such a critical element to have in effective learning. You can go to a lot of courses, you can read a lot of things, you can do many things online, you can go to seminars, lectures, and so on, but then if it's not immediately applied or applied to something that's relevant and meaningful, it's not going to be internalized and you're not going to get good at it. Everybody has a different skill set, it has different personalities, characteristics, some of which are very conducive to certain types of leadership, some of which are counterproductive to leadership. And in fact, our training as physicians, where we are praised, rewarded, encouraged to be content experts, is oftentimes very limiting and very counterproductive to becoming effective leaders because of the skills that are reinforced and the behaviors that are not even acknowledged. So the important thing for physicians was, this is not touchy-feely, mumbo jumbo. There is a behavioral science, there is an organizational science, there is an effectiveness that is science-based, evidence-based, and that was an important part of the physicians accepting and embracing the program. And not only is competence something that you can have naturally, but it's something that can be developed. But it needs to be evaluated, it needs to be measured, it needs to be developed, and there needs to be feedback. It was extremely valuable to many of the physicians in the program that had the opportunity to have coaching and mentoring. Sometimes that can come within organizations. I think those are organizations that are farther along in their development when you can have internal mentors and coaches, but it's also helpful to be able to go outside, have a different perspective, to be able to then help you be more effective in your self-analysis and your personal growth trajectory. So defining the role of leaders, identifying the competencies necessary to be successful in those roles, evaluating leaders for that, and then strengthening and developing skills in those who can, or identifying that people are really not going to be able to develop those skills and therefore won't be effective in those roles are important things to remember.
And action learning is really a way to not only drive toward business results that are high priority results that the organization is passionate about, including the participants, the physician participants, but it's also a way to really build on the critical leadership competencies required to be a strong physician leader. Infiltrate a different kind of a way of communication, which then led to a cultural change in the way that the physicians and administration and then even back to the staff and teams worked with each other.
So you can see how one big strategic problem through an action learning process actually gets redefined into something that's meaningful, where a solution can actually take place.